And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Interim Director at WEIU TV and Radio. My co-host is Mr. Daniel Jones.
Happy Monday, everyone.
And our guest today, making a return appearance, Dr. Eric Davidson.
Hi there.
Interim Director of Health Services here at EIU. And some days when you schedule a host, it just works out that, hey, it was a pretty good scheduling on your part. So lots of stuff going on, but I think
very much so.
I think we'll start off with Eastern's news of the morning, in case people have not heard what's going on. And I'll let you have the floor for that one.
Yeah. I'll be honest, it was a surprise to me. I was wandering around the medical clinic, and my staff were like, "Did you get the email? Did you get the email?" And I'm like, "What email?" And they're like, classes are going to go remote after Thanksgiving. So that's the big information, is that all classes will be online following Thanksgiving break. All of our other operations will remain open, so our residence halls will remain open. Many of the offices on campus will remain open. Really, the significant change will be the classes going to remote. But if students wish to go home, then they'll be able to go home and take classes remotely. If they wish to return to campus and live in the residence halls or live in the community and they're off-campus housing, they'll be able to do that, but their classes will be remote.
And most classes were hybrid anyway, so it won't be as hard maybe as we had to deal with earlier in the year.
Yeah, there was a good fraction of the classes that were completely online, and then several that were hybrid. So it probably will not be as big of a transition for many of our students.
The email said that classes are going to resume, I suppose, regularly at the beginning of next semester. Have there been any talks that you may know of starting remote, or just going ahead and starting how we started this semester?
At this point in time, all the information that I have suggests that we will be planning to start in-person live. There may be some classes that will be hybrid, some classes that will be remote, but my understanding is that there will also be in-person classes just as we started this fall semester.
And that's probably going to be based on testing and numbers and how the state is in late December. There's a little time they can change that. But the other news that came out on Friday is that EIU, and I'm a little vague on this, they're buying this new testing system, which will hopefully quicker test, and talk about that.
Yeah. We're hoping to partner with Illinois Shield, and what we'll be doing will be mass surveillance testing. So it'll be the saliva-based test that they've produced up at U of I. And what we're planning to do is basically randomly selecting a number of students, staff, and faculty every week, and then basically asking them to show up on a Monday, a Tuesday, a Wednesday at a particular time. And we're hoping to test about 500 people a week. And again, mainly surveillance, so that way we can get a baseline and figure out what our COVID rate is, and then be able to determine if it's going up or if it's going down or holding to where it's been.
And this test, is it easier? Is it simpler? Can you explain how it works?
It can be self-administered. So basically, a person would come through. They'll be given a vial. They'll have to generate saliva, and basically spit in the tube and cap the tube, and then it's taken to the lab, which will be in Springfield for processing.
Okay.
Is it kind of different from the nasal? Like, is it harder to test or easier to go through than the nasal?
I've not done the saliva test. They say that most people are able to generate enough saliva on their own and in the moment, but they said that there are some people that do have difficulty generating enough saliva and have to kind of think of a lemon to create that response. The other probably downfall or challenge to the saliva test is those being tested really shouldn't be eating, drinking, smoking, chewing gum, anything like that for an hour up to prior being tested.
So you get real saliva and stuff.
Yeah, exactly.
I get
exactly.
it. Let's go back to Dr. Glassman's announcement to the community as well as Eastern today, because I know that one of the things people are going to say is, why? And I'll let you speak for Dr. Glassman, but why do you think that there's changes on the EIU campus?
I think the main reason is what we're seeing in the state and what we're seeing in the region and in the county. What I would say is, as a university, really the past few weeks have been very slow for COVID. We've not seen a lot of positives within our student body. If you look at our dashboard online, you'll see 2 weeks ago we had 25 student positives. I think the week before that was 10. If we were here 3 weeks ago, I think I'd say I kind of felt like I'm in a twilight zone because COVID business was down so much. I was able to actually do other things. We're beginning to see some increases among our student population, and that's of concern. But I think probably the main reason that Dr. Glassman and the President's Council made this decision is really based upon what we're seeing in the state. And last week as a state, we easily had several days where we had 10,000, 12,000, and maybe even 15,000 positive cases in a day, and that's alarming. That those are rates that we never reached in the spring. So I think the President's Council made this decision being good citizens, thinking about what's going on in the state, what our students may be returning home to during the Thanksgiving week. It just kind of makes sense for where we're at today.
And this time of the year is always going to be crazy to talk about when you think about the holidays, people interacting with social events, and obviously, being at family gatherings. But the numbers are going up. I mean, I'm not really a numbers guy, but when you think about a million in a week nationwide, that kind of hits you upside the head a little bit.
Very much so. It's very sobering.
Yeah. So when you think of that, I mean, what do you think we should do as a community, but we should do as an area as we go forward now that it's so incredibly hot?
Yeah, I think we need to accept the reality of what we're in, and I think the numbers that we're seeing may be not encouraging but motivating to those that have kind of questioned it. I think one of the other things that we're beginning to see is that it's no longer unknown numbers. A lot of people that I'm talking to are saying, well, I know somebody that's had it. I know someone that's had it bad. I know someone who's died of it. I think it's becoming more real. And with that, I think I would encourage many of the things that we've been talking about since March. It's important to wear masks. It's not only important to just mask, but maintain social distance, hand washing, all those protective behaviors that we would do for cold, for flu, we need to keep doing for COVID.
There you go.
Do you think a lot of students are gonna remain home, or do you think they're gonna come back?
I think it's hard to project. I know Housing, before this announcement, had started surveying their student population as to how many students would be interested in staying for Thanksgiving or would be planning to stay for Thanksgiving, and this number was probably about a week old now, but probably about a week ago this time they had about 45 students who were wanting to stay on campus, and students really had until this weekend and maybe today to fill out the survey, and I just haven't gotten any new numbers. So I think we're going to see some students staying home because they want to, others staying home because their parents want to. I think other students will say, I want to be here.
As and Daniel, obviously you're a co-host, but also a student. You've mentioned that you plan on going home for Thanksgiving, but then coming back to campus, correct?
Yes.
Now, what led you to that direction? Did you talk to your family back home, or do you just say, no, I want to be on campus?
I did. Well, I live off campus, so it's a little bit different. The circumstances are a little bit different for me compared to students who live on campus. But also, I think that I love to work. I love to come here to the radio station every day and work. And I think I do better here as far as school is concerned, as far as at home. I feel like at home, I'm not as focused as I am when I'm actually in town, on campus, in the atmosphere.
That's a fair answer, real fair. The other thing we talked about off mic before you got here is something that this is hitting when people are having COVID fatigue.
Yeah.
So how do we get over that hump of I gotta mask, I gotta wash it, all the things that you tell us we got to do,
Yeah, and I'll admit I've got a good fair share of COVID fatigue myself. It'd be nice to take the family out and have dinner at a restaurant, and I'm an assistant scoutmaster, and as things have kind of deteriorating, that's been affecting, whether or not we've had outings, and now that the weather's getting bad and we can't be outside as much, that's disheartening. So I'm fully aware of COVID fatigue and not wanting to do these things. But, I keep telling myself it's for the health of my family. It's for the health of the people that I work with. It's for the health of the community. It's important to do these things because I'm not only preventing and reducing the risk of myself getting COVID, but also possibly spreading it to others if I do become positive. And I think it's something that we all have to do. The more of us who are engaging in these behaviors, the safer our community will be, and the greater the likelihood that we'll begin seeing the numbers go down. So, there's a lot of positive self-talk and encouragement that I give to myself and say, okay, we have to do it. And I kind of look at it one day at a time. Okay, we're going to do it today. And then tomorrow's a new day and got to do it again.
And I'm sure that since you're, health service director, that's all people want to talk to you about, right? They don't want to say, hey, how's the scouts or how's
yeah. A lot of people ask a lot of questions. So, yeah.
So we're going to keep asking you questions.
That's okay.
There is potential, and I'm knock on wood, good news. One vaccine is showing some signs of good health, and I read today that another vaccine is already close to also, being close to the marketplace. As a doctor, how do you feel about the vaccines and the promise of them and all that?
I'm excited. I admit I'm worried about the timelines because you hear anything from December to May.
Yeah.
And I tend to be, I hate saying this, but I tend to be a pessimist and a skeptic. So, I'm anticipating probably more March, April, May than January, especially when we get to full distribution and dissemination to the public. But I'm pretty impressed with the efficacy rates. I think I read this morning 94.5% effectiveness for one of the two. So I'm excited by that. I'm excited by the opportunity of having vaccinations. I think if we can maintain all the protective behaviors and start getting people vaccinated, we're going to see a decrease in numbers, and we're going to be able to return back to something resembling normal. So I'm looking forward to it. I know that there's a lot of skepticism with the vaccines and will they work and will there be side effects. But I think, our FDA and I think those processes, those governmental agencies are really looking in the processes, and they're not going to put something out that is going to be harmful. If there's any question, they'll put the brakes on and redo their testing.
Yeah, because I was talking to a friend of mine this past week when they were talking about the vaccine, and she's like, there's no way. I won't get the vaccine.
Yeah.
I'm like, you've already made that decision, but, which is fine. That's right. Yeah. But, I think we're going to see a lot of a mixed bag of people's opinions, and I think we'll see after I don't know how fast when the vaccine is taken. We don't know how long it's going to be till the success rate is 90 or 95%.
Yeah. But what I hear is people say, I don't want to be the guinea pig.
Yeah.
And unfortunately, it's a new vaccine, so the first round everybody will be a guinea pig.
Yeah. There you go. What is a typical day like now? I mean, do you have any quote unquote normal days, or is it everything? I've got to go to this meeting about COVID. I've got to make sure we order more of these for that.
It's become a little bit more normal. There's not as many emergency meetings. There's not as many last-minute meetings. It's pretty routine. I think as a university, we've kind of gotten to a place that things are standardized. So usually I get to work in the morning. I figure out who's been put in quarantine and isolation. I make the academic notices. We'll occasionally have one meeting a week for our emergency management team, one meeting a week for student affairs directors, and things seem to be pretty routine. So we'll have to see how the increases continue, the news of going remote and how that affects things. So it may pick up a little bit, but I'm pretty comfortable with where we're at as a university.
Recently, for the past 2 weeks, today is the last of the 2 weeks we've been in Tier 1, our region, Region 6. Has there been any significant changes in positivity rates? And if so, what kind of timeline can you kind of make up right now? Where do you see us going up, or do you see us kind of staying in the same place for a while?
When I've been looking at the county and when I've been looking at the region, and you look at their rolling 7-day averages, unfortunately, the news is that the positivity rates continue to climb. I haven't been able to check what the rates were over the weekend to see if we've gone any other direction. So my speculation is probably within the next few days, after being able for the state to analyze data from Friday, Saturday, and Sunday, it wouldn't surprise me if the governor were to come out later this week and say that, okay, Region 6 is moving to Tier 2. I don't anticipate it today. A lot of people think, oh, the 14 days are over, today would be the day, but unless IDPH has been able to analyze all the data and come up with computations, I don't anticipate that for a few days. And when you look at the trends with other regions that have gone to Tier 2, it's usually been 17, 19 days after they were put into Tier 1. So I expect that later this week. If it happens today, I'll be kind of surprised.
Well, I think the reason people are talking about it a lot today is, obviously Dr. Glassman's announcement this morning, but there was a bunch of internet rumors last night and today that the governor was going to make some announcement as early as today. And so, how that takes off and people are, checking everything immediately. And that's the other bad part about this. Social media can be great at sometimes, but it can also really put people into an alarming state without much merit behind it.
Yeah. Anytime the governor wants to make an announcement, I think, part of the COVID fatigue is everybody just automatically assumes that, oh, he's going to be talking about COVID. And a lot of times it is, but, it's hard to know. He could be talking about an economic stimulus package. He could be talking about social services. We just never really know what he's going to cover until it's 2:30 that day and he's covering it. So, we'll just have to see, but he has increased his rhetoric more so about taking us back to level 3, phase 3, phase 2. A week and a half ago, he really wasn't talking about a stay-at-home order, and last week, my understanding is he was talking about that a little bit more openly and publicly. So, he might come today and say, okay, we're all going back to phase 3, phase 2. It's just hard to know what will happen.
Now, do you think it might be a good idea or a bad idea if we did go back to something more of a lockdown where people aren't allowed to do as much as they can now? And I know that's terrible for business, but we also have lives to save at the same time. So we're right on that edge.
From a public health perspective, yes. I think it may be important. We have many K-12 schools that are still in session, and some of the students in the region are meeting face-to-face, and my wife's an educator, so I get to hear a little bit about how quarantines and isolations are impacting the students and faculty that are in person. So from a public health perspective, yeah. I also know that, there are individuals whose livelihoods are dependent upon having an open society, and that's where I get a little conflicted because I don't want people to lose their jobs. I don't want people to lose their businesses. I want people to be successful, and it's kind of a fulcrum. It's like, how do we balance the public health needs and keeping everyone safe while still being able to sustain our small businesses, especially those that are not part of a chain in our community.
And right now, a lot of them some of them make the majority of their money right during the holiday time.
Very much so.
And sometimes they'll make 50% of their money right now, and then 50% the next 11 months of the year.
Yeah.
That's a scary thought.
Yeah. And as a consumer, I'm even caught saying, okay, Christmas is coming up, and normally I would wait till December to buy gifts, and do we need to sit down and start looking at our budget and planning how we're doing that now? And of course, we always try to buy local when we can, and if we're not purchasing now and we end up having a shelter in place and not have the option of going out and buying things, that really leaves online purchases unless you can call in and pick up. So it's a challenge that I think most of us will have to address and think about. How do we continue to support our local businesses if we all have to pivot to stay at home, shelter in, and not be able to go out and buy things?
Yep. you have something, Dane? Okay, go ahead.
Kind of switching gears a little bit to something local. EIU is hosting a testing clinic this Tuesday.
Yes.
And we recently had one about, I believe, a month ago, back in October. So can you kind of tell us what were kind of the results of that one? Like some of the...
Yeah. What I can tell you is that we broke the state record for a single day mass testing. We had over 750 people test during that testing day last time. So that was pretty exciting for us. We have a testing day tomorrow. It is open to the community and county, so it's just not for Eastern students, staff, and faculty. Citizens of Charleston, citizens of Coles County can come in. It'll be drive-up testing. So just as we did last time, folks would enter Terrace Lane and go behind University Apartments and come in the W lot off of 4th Street, and we'll also have walk-up testing as well. So we're pretty excited by it. Being that the state's doing it, they contract with the lab, so once the lab has the positive results and the negative results, that lab contacts students. So we only get to hear about the results if there are positives that are communicated to the county health department, and then they pass that on to us.
Will the students know before they leave for a break?
It all depends when they leave for break. What the state typically tells us is that they like to have the positives out within 48 hours of the testing, but we know last time I think we kind of overloaded the system and they didn't anticipate the number of tests. So I know that there were some students that were still getting results 4 or 5 days after the testing. But I also think there's a portal that students, well, anyone who gets tested can register for, and I think if they register for the portal, there may be a greater likelihood of getting test results back quicker.
For the students who find out that they tested positive that happen to live on campus, are there resources for them to stay on campus?
Yes. So for those students that live on campus, if they end up needing isolation or quarantine, we do have that space. We'll be maintaining and operating that space over Thanksgiving. That space will be maintained after we come back for Thanksgiving. So if anyone does find out that they're positive or have been exposed to someone who is positive and they live on campus, we'll be able to quarantine and isolate them over Thanksgiving. The housing staff have worked really hard. So those that'll be in isolation and quarantine on Thanksgiving and the day after will also get fed. I think they're making some arrangements with some local restaurants to be able to bring in some Thanksgiving-esque type food for those days, and that will allow the dining and catering staff some time off as well that they richly deserve, because they've done a great job feeding everyone in isolation and quarantine.
And how does that work? How much contact does EIU have with students that are in isolation? Because that always worries me that when you hear kids are in isolation.
Everybody who goes into isolation and quarantine has to make daily contact with the contact tracers. Now, that may be by phone, it may be by text, it may be by computer. And then if there is a student that is in quarantine that ends up becoming symptomatic, or if a student has been positive in his isolation and is symptomatic, then medical staff from the medical clinic reach out to them once a day to kind of check in to see where their symptoms are, if they're getting better, getting worse. So we do maintain monitoring from that perspective. The Office of Student Accountability and Support has been reaching out to our students who live off campus, who are in isolation and quarantine, checking up with them and seeing how they're doing. So at least every student in quarantine and isolation usually gets contacted at least once a day, if not multiple times. And part of it is also kind of an assessment of where we view the student as being, and if we feel that a student needs more contact and more touch, we definitely make that happen.
What do students ask you the most when you talk to them on campus?
Oh, I think the biggest question was, what's going to happen after Thanksgiving? So we have that question answered.
If you didn't hear it's all online after Thanksgiving, but Eastern remains open in a nutshell.
I think another question that I ended up getting a lot from students is, what about spring break? And we had that answered. So instead of a traditional spring break, the students will get a non-instructional holiday or stress reduction day, and basically get one about every 3 weeks. I think the other question that I get a lot of times is testing, and where can we get testing, and why aren't we doing more testing through the medical clinic? And part of it's resources, and part of it's staffing, and at this point in time, we're able to test people that are symptomatic that come to the clinic. We do charge $25, and people often ask, well, why are you charging when this entity isn't? And I'm like, well, because that's the cost that we get charged for sending the test out for processing. And typically other places are either billing insurance, and we don't bill insurance, or they're able to have some fund somewhere that they're able to kind of cover the cost, and we just don't have that luxury. So I'd love to give it free, and part of that goes back to the Shield Illinois and being able to do the surveillance testing.
We've got a couple minutes left. We're talking to Eric Davidson, Interim Director of Health Services at EIU. What about the financial burden of everything that Eastern's had to pay for in terms of cleaning supplies and testing and all the other?
It's a lot. I know that in April and in May we were able to get some of the COVID stimulus money, and my understanding is that it was about $2.5 million, and I've heard projections that we will probably spend anywhere between $5 and $7 million. Just all on COVID by the end of this academic year. So that stimulus money is really important to Eastern. There's hopes that we will get additional stimulus money. But it is an expense. And I think as an institution, we're trying to be frugal and do everything that we can with the biggest bang for our buck. But it's an expensive endeavor.
Yeah. Wow. Minute and a half left. Daniel, any other final questions?
You wear multiple hats besides being the Interim Director of Health and Services. You are also the Director of the Illinois Higher Education Center for Alcohol, Other Drugs, and Violence Prevention. Can you talk to us a little bit about that?
Yeah. The state of Illinois gets federal dollars for their substance abuse prevention, and Eastern has been lucky enough now for about 18 years to be a recipient of what's referred to as a statewide prevention program. So essentially we provide services, training, technical assistance and support to any university or college in Illinois who wants to develop or expand their substance abuse programming for their students.
Good question.
Yeah.
You're so prepared today. I'm so
That's
proud.
one I didn't anticipate.
There you go. So I guess we have about 30 seconds left. I'll leave any final words or advice, or just keep telling people to mask up, Dr.
Yeah. I'd say keep masking up, maintain your social distance, stay home when you can, when there's not a need to be out. Remember to wash your hands. If you've not gotten your flu shots, get your flu shots. While you're doing those things, pay attention to your mental health, your emotional well-being. If you feel that there's a need, reach out for help, because there are people in the community that can help.
Well said. Thank you, and have a great holiday season.
Bet.
We are WEIU.